Health Minister Jenny Mikakos has just tweeted. She said Vic has met the under 5 threshold, which some thought was unachievable. This was a very cautious target. 6 of the 7 new cases are related to a known outbreak, so the risk is manageable. The set reopening is gradual and safe, so any delay is unnecessary. She was the former health minister. Surely she's got to... she knows what she's saying.
Yeah, and she's entitled to that opinion, of course. We are just asking for 24 hours, 48 hours to see really significant numbers of tests come back when we know that there are 11 households, but there are still some clusters within the broader outbreak where the linkages between those households are not known.
So clearly you just don't have confidence that you can contain this outbreak.
No. Containment is absolutely something I'm confident about. What I am not confident about at the moment is the cases whose test results have not come back. We cannot contain what we haven't identified yet. So there are some results to come through in the next 24, 48 hours, at which point those individuals, if there are some, and I'm sure there'll be a few, can isolate, and their close contacts and secondary contacts can quarantine.
Your roadmap outlined, maybe this is a question for the Premier, that we would be able to reopen by now. We're less than 5 cases. It's October 26th tomorrow, and there's 1 outbreak, and we can't reopen. There's 1,000 people losing their jobs every day. This is just devastating to businesses. We've constantly been looking for hope. We're here today,
sure.
And we can't because there's an outbreak that
well, we are here today, and we're waiting for 1,000 results, probably more likely 2,000 results. You can't contain outbreaks or cases. You can't isolate people until you've got their test result. This is 24 hours, 48 hours likely. We were not opening up today. There's never been a suggestion that we were opening up today. We'll be making announcements today that would likely come into effect in a couple of days' time.
Sorry, Premier, all week you've been saying that you would be making significant announcements.
That's right.
Today. Yesterday was the first day that you flagged that probably wouldn't happen, and here we are.
I'm not quite sure the point that you're making.
The point is that everyone was expecting big announcements today.
If you're putting it to me that we should ignore the fact that there are thousands of swabs at the lab and they haven't been processed yet, I'm just not going to do that.
That's not what I'm putting to you.
I'm just not going to do that. What I am going to do, though, what I am going to do,
is
though,
that Victorians are devastated. They thought that today there would be significant announcements to make. You were saying that all week. Your roadmap said that we would be able to reopen if we get less than 5 cases on average, and that's where we're at.
Right. Yeah, and we've had a very significant outbreak. We can't properly understand all of its elements until these test results come back. I know it's frustrating. The labs are working as fast as they can. There are teams, hundreds of people out there on the ground working across the northern suburbs to track down every single lead. But we are limited by the fact that the labs take this test takes a certain amount of time. It can't be turned around in one hour. And for the sake of waiting till we get those results, that will give us the confidence, hopefully, to know that these cases are linked, that there's not widespread community transmission in the northern suburbs. It is instead a series of cases that are linked to each other, around whom we have a proper public health response. That is the definition of having contained it, having pulled it up. But we can't presuppose, we can't pretend that we know what those results are until the laboratories have processed them. And if it were the case that there were significant additional cases that are not linked to each other, then that would be a very significant thing.